This lady has what we call brachymetatarsia, which is a short fourth metatarsal. In her situation, a fourth metatarsal that's very short. The toe has normal length, but it doesn't purchase the ground. It's apropulsive, which means that it can't touch the ground, doesn't function well, and she builds up pain along the adjacent metatarsal heads. In this case, the fifth and the third metatarsal heads develop more pressure because the fourth metatarsal is not in its normal anatomical position. So today we're going to create an osteotomy and then put an external fixator on here, and we'll gradually, over the course of the next 3 weeks, lengthen her bone with the external fixator. John,
Like you sent that email.
Yeah, I did it this way.
Okay.
To the bone now, let me just nod it a little bit So we've got the bone screws aligned parallel in the metatarsal, and we're about ready to make the osteotomy. Congenital, absolutely congenital. No question about it. So I like to close the deep tissues and the skin before we put the X-Fix on, because the X-Fix will get in your way. So we close deeply. It's important to close the periosteal layer around the bone. The bone's been cut, it's been aligned, the mini rail has been applied. Now it's a very stable construct, so starting in a week to 10 days, I'll have the patient start to turn this little screw at the end of the device, and that will lengthen these two screws these two bone screws will start to move away from these two bone screws, and we'll get a lengthening process of the metatarsal. And once we get the lengthening of the fourth metatarsal, this toe will then come into place, and it will be able to be matched up with the third and fifth toes.